Right, okay. Welcome everybody. This is the Greater Manchester Practice Managers Forum. Thanks very much for taking the time today. We've got a really packed agenda and we've got some great speakers joining us today. So without further ado, I'm going to hand over to Michelle and she can introduce herself and I'll stop sharing my slide.
Hi, good afternoon, everyone. My name's Michelle Maloney. I am one of the System Health and Wellbeing Project Managers within Greater Manchester Health and Social Care Partnership. So I was asked to come along today just to give an overview of the refreshed toolkit and just give a little bit of information around the Wellbeing Champion role and what that looks like. So is it Rose who's sharing my slides?
Yes.
Yeah. Oh, hi, Rose. Thank you.
Hiya, no problem. I will just do that for you now. Just let me know.
Yeah.
Can you see those?
Yes, perfect. If we can just move on to the next slide, that would be great. Thank you. So good well-being is when we're able to be at our best, both at work and at home. The Greater Manchester Wellbeing Toolkit is an interactive resource that helps to support you to be at your best and to support those around you. As I say, it's been recently refreshed after the first year that it went live at the beginning of the pandemic last year, so the year before, sorry. And it's kind of responded to staff and what they've told us around what matters to their well-being. It provides advice on keeping physically well, practically and psychologically, as well as top tips on how you can support people around you and find help for yourself or someone that you know when they might need it. It is an interactive guide, so you can digest it, the whole thing at once if you like to, or if there's something specific that you want to kind of look at or that is relevant for you or that's showing up or affecting your well-being, then there are different hyperlinks to that as well. The resource always almost sorry, I'm getting tongue-tied, is full of like templates and guides which you can download and share, such as the Good Conversation Guide and workplace action plans and things like that. So it's divided into 3 sections really: a looking after yourself section, a responding to need, and supporting those around you. Okay, if we can move on to the next one, Rose, please. So the signpost, as I say, along with the the 3 sections, it's as I say, you just click on the hyperlinks and it'll take you directly through to the specific area that you want to be looking at, again, whether that is for yourself or as a team leader or manager. It's got lots of guides in there. One specific one that we're going to talk about today is the Wellbeing Champion role. So I'll take the next slide, please, Rose. And the next one. Thanks very much. So Wellbeing Champions, we're hearing lots of talk around implementing, initiating Wellbeing Champion within the workplace and wellbeing conversations. And it's kind of, I just wanted to give an overview of what the Wellbeing Champions are really, and they are kind of individuals who work across all levels across the health and social care system, from all demographics and roles, who want to help support, promote, identify and signpost their colleagues to either local or national health and wellbeing offers. They are such an important part, an asset to kind of any workplace really, in any local team or department. It's not a role that is intended to be full-time or a paid role within an organisation. It's intended to be filled by those staff who are working locally within organisations or teams, departments, wards, healthcare settings that have got a particular interest in health and wellbeing, because that's always good, but just being keen to support your colleagues really in the workplace and to kind of look after each other. They're generally that go-to person within areas. And the reason that they're so important is that, you know, staff who feel cared about, supported and valued within the workplace, it does have a positive effect on patient care and outcomes. It improves staff morale, improves staff recruitment and retention, reduces sickness, absenteeism, and as I said, the role of the Wellbeing Champion is such an important asset to any team, really. If you would like to know more about how to kind of set that up, or you want to know about the boundaries of the role or anything like that, I'm happy to have a conversation with anyone, because I think we are across GM, we're trying to get a network of champions coming together so we can be a stronger force and really kind of embed that wellbeing culture and that shift in attitudes that we're so desperately wanting to change, really, for the better, and have well-being seen as a norm as opposed to a nice to have. So I'll pop the email in the chat as well, along with the links to the toolkit. If you move on to the next slide, please, Rose. So yeah, just some of the resources around kind of those musculoskeletal issues. Again, click on the hyperlinks and it'll take you to PDF things that you can download. We just got a question.
Yeah,
Does
hello.
someone want to... Hi.
Yeah, hi, sorry, it's Mike Neville here. It's just when, because I think this could link in quite well with the IGPM in terms of what we're sort of looking to do anyway, in terms of being a sort of supportive function to colleagues across practice management. So it's whether, you know, a different conversation off after this, Michelle, in terms of how we can sort of link in. Myself being the GM and Lancs rep, we've also got one of the directors based in Stockport, so Kay Keane. So we've got a couple of people locally who could potentially support this. Yeah,
absolutely. I'll put my email in the chat and we can pick up a conversation after this. Great, smashing. So yeah, lots of hyperlinks, lots of resource that you can kind of download if you wanted to, that you can share with colleagues. Not going to go over on them all, obviously, because it's just packed with different resources, but the ones in particular that I want to draw your attention to are dealing with what's in your control, the stress and anxiety, and finding that kind of you know, that buddy guide and things like that, where, you know, if you are a lone worker, who are you connecting with, who's checking in on, not checking in as opposed to checking up. And I think that there has to be that significant difference, really, when it comes to supporting our colleagues and our well-being. So as I say, there's a good conversation guide in there. There's a series of podcasts and spotlights on, and, you know, loads of things. It's not about reinventing the wheel either. You know, I know there's lots of resource out there, so it's a document that is for everyone, a toolkit that's for everyone. Pinch with pride, you know, but please have a look at it. I'll take the next slide, please, Rose. Yeah, as I say, I'll put the links to the toolkit, the podcast series. We've got a specific podcast on Wellbeing Champions. We've got a menopause one that's going to be released today. So, you know, tap into them, have a listen while you're on a lunchtime wellbeing walk in an ideal world. But yeah, like I say, tap into it, have a look at it. And then the next slide, please. So working with our partners across GM, obviously primary care excellence, shining a light on suicide, the Good Employment Charter, mental health toolkit for employers. That's all those links, the bereavement service and the GM Resilience Hub, all the links to those various kind of, we've took the best bits from everyone, really, and they're in that kind of one place where you can access them. So yeah, just have a look at them and see what you can do to support yourself and to support those around you, really. I think that's the end of my slides.
Yep.
So yeah, very much a whistle-stop tour. Happy to share those few slides with the attendees of the meeting, and also the links to the toolkit, our email address, and our links to the events that are on kind of Eventbrite really. So covering the themes that are flagged up, very much menopause is on the radar, and lots and lots of engagement, lots of interest in that, always oversubscribed. My next challenge and goal really is a bit of a call to action about getting our male colleagues on board and getting them interested in knowing exactly how menopause affects females in the workplace and what they can do to help and support, not feel frightened of having the conversation, very much breaking that taboo. There's been loads in the headlines around menopause lately, so I'm really kind of on with that next challenge. So if there are any males on this call today and you see a male menopause session, please book on. It will not disappoint. It's a really insightful kind of subject, and it's great. You know, it's good that you should know about the things that show up for women. LGBTQ, again, we host sessions around those health inequalities, around, you know, again, our diverse and different characteristics for people, and how access to healthcare isn't kind of the best. Sadly, we've run a couple of those sessions, and that's really highlighted quite a significant you know, we're not equal across the board. So, you know, more of those sessions to come. The MSK sessions, the musculoskeletal, I think I said it right. Again, we've had a session this morning, great engagement, lots of work around that still to be done and is ongoing. And then kind of looking after yourself and your teams, our bread and butter type sessions that I kind of run around checking in with your team, that self-care stuff. Nothing enlightening, I'm afraid. You probably already know this stuff, but to revisit it, to come back to it, and often make people actually check in with themselves and think, actually, I do need to look after myself more, to be able to look after those around me better. So that's it from me. Is that all right, Kerry, Rose? Yeah.
No, that's great. Thanks very much, Michelle. Before we let Michelle leave, has anybody got any questions for her? We will be sharing all the slides and all the links, so yeah, fantastic. Thanks very much, Michelle.
Thank you. See you all.
Okay, so next on the agenda is Sati Bose. Sati, are you with us? Yeah, there you are, coming up. So I'll let Sati do her own introductions and hand over to her.
Hi everyone, so my name's Sati Bose. I'm the Workforce Programme Manager at Salford CCG, and I've been tasked with leading a GM piece of work. And when I say tasked, I actively sort this out because I do have a passion for this work area. So what I'm going to do is I'm just going to share my slides and talk to you a little bit about. Now I can only see you, Kerry, at the moment, so if there's any questions, we maybe keep them till the end, or Kerry, you please feel free to interrupt me. So I've put my email address on that first slide. I'll share these slides. I'm not going to talk about every single detail because I'm conscious you run to quite a tight timeline with this meeting. So let's just get this on slideshow. Okay, so the need for a focus on non-clinical workforce was raised at the CCG Workforce Leads meeting, and I would have to say, I'm sure Kerry would agree, something that I have championed and badgered about for some time. So for me, there's a need for us to give parity of esteem with the work that's been done on clinical roles and the career pathways that we formed in primary care around perhaps some of our nursing colleagues. And I'm not sure that we've given that same parity of esteem to the non-clinical roles that do so much to support primary care. So this was about my call to make recruitment, retention and career progression a system priority in GM. something for me here around culture change. We need to improve the opportunities available and create greater equity and standardisation for our non-clinical workforce. So the reason I'm here today is that I fully appreciate that this isn't something that we go away and do. Really keen to engage with this group regularly and make sure that engagement with you as a group, and in fact there's quite a few names I've seen on the attendance list of people that have already been roped into this piece of work, willingly I might add. So this is about your involvement and making sure that you're not done to, but that you shape the work that happens. I'm going to go over this really quickly. So there was a lot of work that went into the workforce leads, helping to getting information and anecdotes from their non-clinical workforce around what the issues were. It felt enormous. It felt like there were so many issues that, very long story short, we did some workshops. I spent ages trying to consolidate into some kind of map. So came up with the driver diagram, which you can look at in more detail after the meeting. And there were kind of three key areas that we felt were important. There were bits around career progression. Then there's that whole bit about culture and values and equity. So there's a lot about mentorship and leadership and portfolio roles for the clinical staff, but less so, I think, for some of the non-clinical roles. And then there's this whole messy business about business models and terms and conditions. So I'm sure you'll agree, some of it is in quite a difficult to do box, and that's probably some of the stuff in that bottom bit around business models. Anything that's in red on that diagram is work that's already started. So around culture and values, there's, as we've just heard from colleagues from Primary Care Excellence, there's a lot of work going on around health and wellbeing and some of the primary care excellence things that are happening. So it's not about reinventing or doing it all in a particular way. It's just about trying to understand it as a holistic piece and taking it in bite-sized pieces to see how we might improve the situation. Now, after we'd started on this piece of work, we became aware of a national programme. So this has been recognised not just by GM, but it's a national issue, and there is a national programme that's focusing around the development specifically of practice managers and PCN business managers. Now, originally that was in our kind of scope in terms of the whole career pathway. So some of you may have been involved in the workshops that national programme held in February, March. And the latest update is that that's been collated into a report. They're planning some bite-sized learning sessions and they have been working with IGPM from February. And they're taking a very similar approach. So they're looking at a career and competency framework that will be supported by a leadership development programme. So they're looking at all sorts of routes there that you can see in that bottom bullet point. So what we thought was, if the national programme are starting at kind of that end of the spectrum, we should perhaps try and see if we can work in a similar way to build competencies, but maybe look at the bit that the national programme isn't doing. Now, I sit on that national programme group, so it's an opportunity for us to kind of blend what we're doing with the national approach, so we can learn from each other, but also, more importantly, make sure that it all aligns and makes sense. So what we thought we would do is we would start with the bit that is probably quite crucial and core, which is around career progression. So we're looking at a priority around developing a foundation or a GM standard for the roles that you can see there. And as you can see, in terms of the driver diagram, that's how it links in. So it's about career pathways, role definitions, competencies, that kind of thing. So I'm going to just show you who we've got involved. So for me, right at the top there, this is fantastic. So it's been hard, I know, for non-clinical staff to free themselves up, but there is passion and interest for this piece of work. I can see names in the people that are here today who have kindly volunteered to help out. So practice managers, business managers, largest group amongst the steering group and involvement in the work streams today. We've got 13 from across GM. Some of those are dual role. So of course, somebody like Mike Neville, who I know is on the call, IGPM, but also practice manager. And we've got some people that are practice managers and non-clinical workforce leads. So we've got, together with the other system stakeholders, a really good, interested bunch of people that are committed to taking this work forward. And hopefully, because we've got quite a strong representation from our practice manager and business manager colleagues, we're going to be coming up with something that's meaningful and will make sense to the community that we're trying to do the work with. So I'm going to just bring you up to where we're up to. So we've had 2 meetings. We've agreed a high level outline. You can see yourselves there. So we're going to start by looking at the first bit around trying to map a standard for a non-clinical career pathway. And then at the same time, we're going to try and map out all the training and development opportunities that are already available. So in order to do that, we've convened 2 task and finish groups who have been tasked, as of I think it might have been last week, with developing their project outline plans and reporting these back with timelines by the next steering group, which is on the 16th of June. So we are moving at some pace now with this and looking to get action and get things in place. Once we've done those 2 pieces of work, we'll have a pathway, and then we'll be able to look at what's already available and kind of put the 2 together, do a gap analysis, and then we'll be able to action plan around any gaps identified. I'll just show you, I'm showing you these because there may be people in the group who are thinking, actually, I could contribute to this. So I'm not going to read this verbatim, but it's there for you to have a look at. These are the 2 groups. What I've tried to do is make use and benefit from all of the expertise that we have on that steering group. And for me, the bit around the non-clinical career pathway needs to be led by the people working in these roles, not by a set of stakeholders, the system stakeholders that work external to that. So we've secured a chair for that who is a practice manager and a non-clinical workforce lead. With each of these task and finish groups, I've managed to secure help from some of my CCG workforce lead colleagues in recognition that where somebody like David has volunteered to do this, it's going to be really hard for him to do a lot of the organising, the planning, the pulling together. So the CCG workforce lead is literally there to do that support role and to make sure that it happens and implement the things that the chair needs help with. For this one, the membership isn't other system stakeholders, it's around non-clinical workforce roles. I want this to be designed by people in these roles, not by somebody who thinks they know what these roles should be doing, but the people that are actually doing them. And you can see there, these were just a set of deliverables that we've set out with. But that task and finish group, I've got a meeting actually at 2 o'clock with the task and finish leads today to go over this and start to get those groups convened and to start to plan how they're going to take this piece of work forward. More importantly, to come back to me with a time scale of when they can do it by, hopefully by next week, maybe. No, we'll come back with some time scales to the June steering group and start to see how we can implement this. The other task and finish group, I'm trying to make use of some of the other system stakeholders who know about all the training and the links to the HEIs and some of the training pathways that are out there. So that group have kindly agreed to do that piece of mapping work for us. And we've got some links in with existing pieces of work with HEE and past work with Kickstart that we can use. So this is about trying to strengthen the pipeline into primary care as well, and some of the programmes that we might be able to put into this kind of pathway and training that we have. And my vision is that when we finished it, it'll lend itself to something that can be on some kind of platform. So linking in with some work by Kath Smythe about workforce development and training and accessibility of training. So I'm seeing something virtual where people can hyperlink into various aspects of the pathway and see the training that's available. So that is me in a nutshell. I'm going to stop sharing. Aware I've spoken fast, but I saw the bit about please stick to your time or you will get a big stick waved at you. So, okay, Hayley.
Hi everybody, I'm Hayley Savides, the PCM manager in Odsal and Claremont in Salford. So knowing of Sati's work and the passion she's got for this, and I absolutely share the passion for this piece of work. This is just something that I think is absolutely lacking in healthcare for non-clinical teams. I actually was a receptionist in a GP practice many years ago. The only way for me to career progress through my career and end up where I am now is by moving and learning on the job. There's never been a pathway, and it's been a frustration of mine for many years that I've had to literally fight every step of the way to learn. And there's so many gaps that I even know I've got now in my knowledge, because you don't necessarily, as like a nurse would have you can't go to the next stage until you've ticked these competency boxes. We just don't have that, and I see it in the practice managers. But one of my biggest worries, and Sati knows this, is about time that's released for primary care and the recognition that protected time for our non-clinical workforce to be allowed to do this. I've just looked down the list and I can't see, maybe there is people, but I don't recognise like many of my Salford colleagues, practice managers on this call. They're too busy, they can't get off what they're doing. They don't get released to do development, and it's something that equally frustrates me, because I think clinicians automatically maybe and more recognise that they need protected educational and learning time, but non-clinician managers in particular, it's not there. It really isn't there. And I think it's something that systematically we've got to look at and change, but also the only way you can do that is physically putting people in to allow them to be released. I don't know how we do it. I don't have an answer to it, but I think we've really got to look at what we need to do as a system to support our managers. And even looking back at the health and wellbeing work, I've tried to do some of those things with our managers. Trying to get them to have a break is neon impossible. Trying to get them not to work at weekends and evenings is not possible. And I think the reality really needs to be held up to the system to actually show the volume of hours, physically hours that people are actually working and putting in at the minute, because we can do all these things, but unless people are going to actually, I don't know, put some extra support in to release people to do it, it's not gonna happen. But well done, Sati. It's all great.
Mike, did you want to come in?
Yeah, I think it's really interesting, because linking in non-clinical and clinical, because the BMA are obviously looking towards rather having how many sessions people are working compared to how many hours that people actually do from a clinical point of view as well. And I think there's a lot more similarities than there are not when you're looking at workforce, whether on both the clinical and non-clinical pathways of what current workloads are, what demands are. I think the difficulty is that ultimately it is that everybody is a small business and they have the balances to pay. I mean, when you look at something similar to how Morecambe Bay have recently, NHS Trust have recently trying to put out a budget of a 44 million deficit. Trying to balance a book, would a partnership ever try to have a deficit? No, because that's that's how the GP model works. We can't have a deficit because the partners mean the partners don't get any income at all. And until there's the specific funding that comes into place with the management development, it's going to be very difficult to convince a partnership to create more managers, basically, because the role has evolved so much over the last 10-15 years. You know, a lot of partnerships still have the old school approach of what is a practice manager. Is it a senior receptionist? Is it, you know, somebody who does X, Y, and Z? And until the education for partners really to understand our role more is put into place, and a sort of enforced learning for them as well as part of their I suppose many do appreciate the role of the practice manager, but it's whether they understand it or not, and that's like the difference in those comments. But 100% agree in terms of what you were saying there, Hayley. It's making sure that we try to get enough time for people to do stuff when we already have no time, we have negative time available.
The only other thing I would add is that when I've been championing doing this, the number of times I've heard, yeah, but it's really difficult, it's in the difficult to do box, and the number of times I've said just because something's difficult doesn't mean that we don't do it. I'm fully aware that this isn't an easy thing to fix, but I will be damned if I finish my career without doing something about it. So I'm hoping, is this group the right place to engage with you? I'm conscious now of what you're saying, Hayley, that there's lots of people that aren't here. Kerry, are there other ways of getting the information out to everybody? Practice manager colleagues, are people likely to read it if it comes out and they haven't been able to come to the session?
There is that, isn't there? Because practice managers are telling us that they're already overwhelmed with volumes of emails. And actually, when the group was first set up, we had in excess of 150 people attending, and actually that seems to be declining. So maybe we need to look at how we promote this particular event, because it is literally an hour. That's why we keep it so short and people to tight time frames. And actually the feedback that we got was that this was a great forum and a great way to share information instead of sending yet another email. So maybe we look at that, and maybe we link it with the workforce leads to see what kind of practice manager meetings they've got at a local level. And is there something we can do if we're going to do something across GM? Is there something where we can kind of come together and work on that?
Yeah, I'm conscious of time, so just to say, you've got my email address. If anybody wants to talk to me or email me, I'd be really interested in people's perspectives and welcome any support at all from anybody in the room.
There is one hand up, Sati. I can't quite. Oh, hand's gone down.
No, it was myself, Chami, but I think Mike really he really articulated in a really good way. I'm one of the practice manager, but we as a local service, we did had some practice manager funding role, where we all attended. So I think it's we are very overwhelmed, with the role is being really evolved in last, of course, 10 to 15 years, but in last 5 years has been evolved like everything. And it's the GPs appreciate, they do value, but if he's quite rightly said, if there is a protected and a funded time, then I think we are more likely to even attend the course or do the developments. I think that's the main key, because it is overwhelming. Today is my day off, and that's what I managed to attend the course. Otherwise, I would have missed it. So this is the really true picture what Hayley and Mike said.
Yeah, I'll keep that key message around funding protected time. That's
thank
really
you.
Sorry, Kerry, I've overrun.
No, that's great. I mean, the thing is, this is on the programme now, the Greater Manchester Programme Workforce, so it is getting attention, and it is getting it is included within our programme. So I have to say, let's kind of take a view on kind of the work that Sati's taking forward, and see how far we can get. There's always room for improvement, isn't there? So
absolutely.
Thanks, Sati.
We probably won't get it all right, but
no, but it's a start, and then we can kind of look to review and lessons learned, can't we? So
thank you very much for having me. Bye, everyone.
Thanks, Sati. Okay, so we're going to move on to Louise and the training hub. So I'm going to hand over to Louise. Thanks, Louise.
Hi, I'll just bring my presentation up. Okay, Kerry, can you just nod if you can see that presentation, because I can see you, that's fine. Hi everybody, I'm Louise Thornton. I'm one of the clinical leads for the training hub, and Salford and Trafford is my locality, but I've come here to talk to you about the NHSE General Practice Nurse Fellowship. Apologies to anybody who's heard me speak before, because we do host monthly webinars, so it is the same presentation. So just to sort of say, it's a fantastic opportunity to support recruitment, retention, and highlights a real career pathway in primary care. Just a bit of a broad overview of the programme. So it's a GPN Fellowship Programme, and it's modularly structured. It's got 4 modules and it runs over 2 years, so 24 months. We do have a fundamental element within the fellowship programme. So the first 25 weeks are totally focused on clinical skills. At the end of those 25 weeks, the nurses sit an OSCE examination based on the clinical areas. Successful students then continue and complete modules 2, 3 and 4. And just to say, practices are supported throughout the year, without the 2 years, with a financial incentive, which works out of just over 5k per year per student. So the aims and the objectives of the fellowship, as I said, is to encourage, support, retain, develop newly qualified nurses and employ them in primary care. We want them to be fully competent, highly motivated, and we want them to be able to champion that role of a general practice nurse. And ultimately, what we'd like to do is to encourage students to choose primary care as their preferred career choice. So again, a little bit about eligibility. So to be able to access the fellowship programme, you must be employed by a GM practice. You must be newly qualified within the last 12 months. I said earlier, it's a 2-year programme. The first 6 months requires 1 day out of practice. That's to complete the fundamental programme. And then the 7 to 24 months require approximately 1 session per week to be flexible, but also to fit in with the practice. So that means that some work might be done outside of the practice, but some work within the fellowship, like a quality improvement program initiative, might be done actually within the practice. I did say about the salary support, so it's 5,330 per year, which works out at 102.50 per week, and we're hoping to run the next cohort in the autumn, either September or October. Just a little bit about the fundamentals. So you can see a list of the fundamentals that's covered in the first part of the fellowship programme. We do try to front load as well, so that practices are supported with the immunisation, the cardiovascular, the respiratory and the diabetes. And we also support the nurses to complete the SSSA training. So that means that as a practice, you could also host students from universities. Again, this slide is just another overview of the 4 modules. So I won't talk through this in depth, but the slides will be shared so you can have a look at that. But just picking up some of the other modules, sort of learning and development. I've mentioned access to clinical skills on foundation course. We like the nurses to understand about practice management, the role of the practice manager and the role of all the other admin team within the practice. We do an element of leadership and we support them to complete the Aqua Quality Improvement Programme with a hope that they will pick up some quality improvement either within the practice or across your PCNs, working with other fellowship nurses. They do have access to mentoring and supervision. We do ask that we do have a mentor from within the practice to support with sign off of the clinical skills. There is also 6 hours of coaching provided over the 2 years. So that's actual coaching for the individuals around their career development or any problems that they might be having as newly qualified or as being on a fellowship programme. And we do encourage peer support as well. So the team are always there to pick up any issues or any problems over the 2 years. We do ask that they do pick up a PCN portfolio project as well. So that's sort of looking at how the general practice nurses either work together as a team across the PCN and perhaps pick up some project work that they can work on together. The mentors and supervisors that I mentioned earlier, we do offer some support to them as well. So we offer a couple of sessions with some backfill to support them to look at coaching conversations, mentorship skills, and supporting them to be a mentor and a supervisor. I've just mentioned the last point about that being supported as well across the 2 years. So why do we think people should enrol on this programme? So opportunity for newly qualified nurses to upskill. Like I say, the fundamentals does front load those key elements of clinical areas that are needed to function as an effective practice nurse. We hope it builds confidence and delivery in primary care. It provides some protected time for learning and development. And it guarantees a level of support through their journey whilst they're sort of building that career pathway in primary care. Just briefly, it does give you access to the SSSA training. So if you as a practice aren't an educational placement provider, then you would have a person who'd undergone the relevant training to be able to host students within the practice. This slide is just a little bit about being a practice learning environment, and I won't talk through this, but if anybody wants any further information, I'll put my email in the chat and I can direct you to one of our locality PEFs. So how to apply, there's the details of how to apply and the details of where to return your applications back to. I'd just like to add as well, we do have coming out into GM a cohort of 3rd year nursing students on the final placements who are wanting or considering to working in primary care. So, you know, if there are any of these students that would fulfill a role within your practice, think about the fellowship programme. Because like I say, the fundamentals helps with those clinical skills and the quality improvement helps with improving quality within practice for both for patients, etc. They learn the leadership skills and they are also supported for the full 2 years by the team whose names I have put on this final slide. Any questions? And I know Kerry has put 2 questions into.
I have, yes. So I'll launch the poll if that's all right, Louise.
Yeah.
Please let me know if you can see it. So basically, it's asking, have you heard about the GPN Fellowship Programme? Really simple. Yes, no. Can you see as the poll launched?
Yeah.
Oh, I can't see that bit. There you go. So that's great. So 80% of you have heard. That's fantastic. So that's quite reassuring. In terms of kind of like next steps, so hopefully the next question, would you be willing to support a newly qualified nurse to access this programme? So bearing in mind that kind of all the benefits that Louise has talked about. So yeah, that's quite reassuring. More yeses than it is no's. And then kind of probably really interesting last question for you is, in terms of, where are we? I had another question.
Do you want me to read it, Kerry?
No, I was gonna say, so the next question is, in terms of kind of supporting a newly qualified nurse, or kind of, as Louise was saying, those student nurses, what help do you think you'd need in order to support the newly qualified nurse? Estates, yeah, that's a massive one, isn't it? Recruitment in the first place, well, that's a really interesting one, because we're going to touch upon that in the next section. Hours in the day. So is that your hours in the day? You've not got enough hours. Okay, States is coming up again with clinical rooms, isn't it? Okay, so that's really great intel actually for us in terms of kind of how we're shaping the programme. Mike, do you want to come in with your question for Louise?
Yeah, thanks. I mean, it was me who immediately said estates for a start, and I think as the first response, that is ultimately any practice's first hurdle. But my actual question though is, going back into the actual study itself, the student days, how much of a nursing degree is actually primary care, or sorry, not primary care focused, but general practice focused? Because the nursing within secondary care is very different to general practice.
It's not, is it, Louise?
It's not, no, and I think this is very new, this rather large cohort of third year students, so I think it is improving, but no, like Kerry said, there is not a large focus on working out in primary care. It is more focused towards secondary care and community care, but primary care, no.
Because I think from my experience in the past, I mean, I've been very fortunate. I had one of my old HCAs went off, did a nursing degree, and now she's come back to us as a nurse. So we sort of gone full circle with her sort of training. But from when we're looking at expanding the nursing team, a lot of the issues were the fact that people who were experienced were either preferring to locum, or they didn't really want to move, but they were trying to see if the grass was greener, because they'd just been so inset to their own practice. And I suppose it's having an understanding of the mentality of the people who are looking for work. Is it the fact that they're looking for a job, or how much knowledge do they have about general practice in the first place to make them want to consider it? And I think that's where, if there's some sort of way that general practice could be, I suppose I can't really sort of add it to the curriculum, it's not really our place to do it, but that, I think it's a sort of wider national sort of issue in terms of a training program where general practice just does not feature at all, or very minimally, in somebody's development, especially when you have quite a lot of negative press around general practice and how lazy we are and how we've been closed for the last 2 years and all the rest of it. It's that there's only so much we can sort of do, but in order to myth-bust for those individuals to sort of see how great it is, they need to experience it and they need to have input to it. And it's how I suppose we as practices, as a collective as well, can sort of help in some way, help shape and form that change.
Yeah, I would agree. And interestingly, our first cohort of fellowship nurses started with us last September. So they've just completed sort of the fundamentals along with some other nurses. And I was privileged to do the OSCE examinations with them. And when I was asking them about the backgrounds, interestingly enough, we have an awful lot that have come to primary care from community care, which they will have had a little bit of a flavour of primary care working out there in community, but they have, made that transition from community to primary care. So there must be something in primary care that is, attracting people, relatively young people, into primary care as well. So, but
I know one thing.
You're right. I think there should be something within the university curriculum apart from just that optional placement of coming out in your third year.
The obvious thing is obviously the hours. When you're referring to sort of younger people, it's more than likely family related in terms of what their driving factors are. From what I've experienced anyway, anybody can feel free to jump in and correct me on that one if they've found anything different. I think Michelle Carmichael's obviously put in the chat there she's a 2 from community. I don't know if Michelle, you want to jump in here for something that we've had when we talked about people coming from community into general practice, is the difference in salary expectation. Obviously, the AFC banding does go in quite high, and then general practice, you sort of have to come down a bit in general to, I suppose, coincide with the fact that you don't have to work the shift patterns, you don't have to work bank holidays, you don't have to. That's what we found anyway when we've spoken to community experience. So
well,
Michelle,
there is some interesting pieces of work, isn't there, that's happening at the moment. So Louise indicated that there's 41 students that are coming to work in general practice and that exposure. And also there is some aspiration in terms of Leslie Royal-Pryor's work, and that she's discussing with the training hub in order to kind of get people exposure to primary care. Charmy, you had your hand up and it's gone down, so I don't know if
no, it's, I wanted to just double check. Like, you know, I think we had currently we have somebody who's working from secondary care and working in a primary care, and Alison just said the same. We have to have 2 nurses at the same time, you know, so we can train one of our nurses who's just joined the practice. There is no funding or there is no course, anything related to those staff who's already qualified nurse but never worked in a general practice, because it's a lot of training and, like, you know, you're pretty much training them again in a way. So is there any place or any funding for those, or can they tap into these courses? No,
not the fellowship, but there was the foundation programme, and the last cohort just started in April. It is on the agenda to be reviewed, because obviously we recognise that there is a need for that foundation training as people transition into new to primary care. So that is currently being reviewed at the moment.
Because when we're doing the recruitment, we're having same problem what Mike said. Like, either they have wanted to do a locum, either they have like, you know, they because they are so set in their practice, or we have so many nurses interested, but they are from secondary care or community, you know, so who's not worked in a general practice. So then it takes about 6 months to train them and get them in the way, like, you know, the practice works. And you have to have 2 nurses at the same time, because of course, like, I've just, like, you know, book her for a smears and everything, and there is absolutely nowhere. Like, I was if I don't train her, I wouldn't have a nurse in 2 months time, you know, so it's really difficult for the practices, I suppose.
Yeah, and that you know, supports the need for a foundation, doesn't it? Thanks for that. Michael, you've got your hand up. Sorry, Michelle, you've got your hand up. If we can make this the last question for Louise, so we can move on.
It's not a question, it's just picking up on what Mike said. I've done it twice in the practices I've been in, so what I've done from community and secondary. So there is some expectations because of salary agenda for change. And it was probably easier to transition a community, so a district nurse, and did go on the foundation course, which was really good for her, and you know, she learned a huge amount from it. Secondary slightly differently, but did come in with a different set of skills and was easier to adjust. But they do come in, unfortunately, with an expectation that, you know, holidays need to be the same as agenda for change, and it's not that we don't want to do it, it's just not affordable in general practice. And that's what you find when you're trying to recruit nurses, not new nurses that have been in different environments.
No, thanks for that. Louise, thanks very much for that. Generated lots of conversation, and I think it's something that maybe we need to revisit at another meeting as well.
And I've sent Rose the presentation. I think you've got it in your email box. Okay, thanks everybody. Bye.
Fantastic, thank you. All right, so moving on, and myself and Rowan are going to help with this. So somebody did say before you needed help with recruitment. So we keep reiterating this message, so hopefully it will resonate with you today. So some of you may or may not be aware that we've got a primary care careers event that's being held on the 12th of May, and shockingly in my mind that's next Thursday. So the careers event has 2 sections. There's going to be a school zone where we're inviting school children along to basically help them understand all the great opportunities there are working within primary care. And then the stall holder that is open to students and also to the general public who might be looking for jobs within primary care. And within that section, there's going to be presentations from disciplines across primary care, explaining and sharing their knowledge and expertise around kind of their career to date. So on the stall holder section, the first stall that people will come to is going to be GM Workforce Connect. So those of you that aren't aware of that, it's basically our digital job matchmaking program. So if you've got a vacancy, I can't stress enough, please get it registered on the GM Connect, and Rowan's going to talk you through how to do that. The one thing that I would say is that we've actually been working with the Department of Work and Pensions. I had a meeting last Monday with 100 job coaches who are basically pushing this event out and getting individuals that are looking for a job to register on GM Connect. So hopefully, fingers crossed, we'll be able to attract those individuals that are starting out on the career and get them linked up with you. So, Rowan.
Hi there.
There.
Can everyone see my screen for starters?
Yes.
Yeah, that's okay, is it? Okay, great. What I'm showing you here is a how-to guide, which will be distributed after the meeting, which gives you instructions on how to take ownership of your user account on the GM Primary Care Careers platform. Once you've reset your email, your password, sorry, using your email address, you'll receive a link to be able to set your new password. And once you've done that, you'll be able to log in. Now, why bother going to do that? Well, the reason today to explain is that by taking control of your user account, you will find that as the practice manager for your general practice, we have set up a profile for your practice on GM Workforce Connect, which is the job matching service connecting people and employers with employment opportunities and primary care. So if you visit the first URL, it will take you to a place like this where you can enter your email address. That will then send you a link via email, which you can click on to reset your password. Once you've reset your password, you can come to GM Workforce Connect and you'll be able to log in with your username or email address and your password, and then you'll be logged into the Connect service. You can visit my profiles if you've got more than one. So we have some practice managers who are responsible for more than one practice. My profiles will enable you to see all of the profiles that you own and are responsible for. Once you've visited that, you can access each individual profile. So here, for example, I'm looking at all of the general practice employers across GM that have active job vacancies listed. So we can see a range of the general practices down here, and we can go through and look at some of their profiles to give you an example of what that looks like. So I've been in touch with a range of practice managers who are in attendance today, and they've given me permission to show you their profiles and edit their profiles so you can see what it's like when you go on and take ownership of your practice profile and how you go about adding a job vacancy. So if I was Karen over at Collegiate Medical Centre, I can come and view the practice profile, and I can click on edit profile. Apologies, let me just reload that. Click on edit profile, and then what I'll get is a number of collapsible, expandable sections with information in that can be edited. So we've got an about you, which has got your basic information, your name, your email address, telephone address, that sort of thing. But then what I'm really interested in today are the workforce connections. So as an employer, you can tell people where it is that you operate. So Karen's indicated that Collegiate operates in Manchester, that the organisation type is general practice. As a consequence, can select the locality, the primary care network, the general practice, and the NACS code, which is unique to Collegiate, and then can go on to indicate the primary care domain that you want to recruit to. So obviously in this case, it's general practice. And as a consequence of selecting general practice, we get a range of general practice roles that you're offered in terms of being able to select the ones that you're interested in recruiting. You can indicate as well whether your practice has a skilled worker visa, and then move on to indicate whether you've got any job vacancies. So having selected, for example, yes, that I do have vacancies, I can select how many vacancies I've got. In this case, I'm going to select one. And then what I need to do is enter the URL of the job vacancy advert. So I'm just going to pull this up in a separate tab so we can see what on earth that means. That URL is the link to the job advert that Collegiate has for the salaried GP on NHS jobs. As part and parcel of the HR process, many of you will be familiar with posting job vacancies on NHS jobs. What we're offering here is the opportunity to connect that job vacancy that already exists through to your profile on Workforce Connect, where we have over 160 people currently registered, actively looking for work in predominantly general practice across GM. So we paste that URL in the job vacancy URL box. We put a closing date, so in this case, the 15th of May, and then we can click update. What that'll do is that will reload the profile. So we'll see Collegiate's profile, where Collegiate is based, mapped on a map there. We've got the fact that we're looking for, in this case, I think, what was it? We had a salary GP, so bear with me. I'm going to re-edit that. Let's change that. I'm going to go in and change this to say I'm looking for a general practitioner. And obviously it's really straightforward to keep this up to date. In terms of the job vacancies themselves, one of the things that's important to note is that having added the job vacancy, that is all you need to do. You do not need to remember to remove the job vacancy. As soon as the closing date has passed, the job vacancy will automatically be removed from the profile. So all that you need to remember to do is to add job vacancies as part of your general HR process. If you're going through to NHS jobs and posting a job advert, why not come through to Workforce Connect and add in your job vacancy? Just going to go through to one or two others. So here we've got Denton, and Kate's given us permission, and you can see here that we've got two job vacancies displayed here. One that closes on the 7th and another that closes on the 20th. So I'm just going to go in and edit and see what that looks like. Once again, bear with me. Let me just refresh that. Once again, we've got the About You with the information, the basic and contact information. Then we've got the workforce connections, and we can see here that we've got, for Denton, we've got advanced clinical practitioner and general practitioner listed as the roles that they're interested in, and the fact that they've got two job vacancies and therefore are able to post the details of the two job vacancy adverts. So here we have the job vacancy advert for the advanced clinical practitioner, and then we have the advert for the salaried GP, and all of that's on there with the closing dates. Click update. Obviously we return to view the entry. Now, why does that matter? Well, we've got a lot of people registered who are currently looking. So we've got, just like we've got employers that have indicated they're looking for particular roles in general practice, we've got people looking for work who have also said they're looking for example, wanting a role of advanced clinical practitioner or GP or general practice nurse or receptionist. And they've also indicated that they're looking for work, for example, in Manchester or Bury or Bolton. And so what this does, the system does, is it matches up the vacancies with the people looking for work, and connections are then made. Equally, you can go as an individual and find a general practice that's looking for a particular role, and you can connect with them manually. And what that will do is it will create an email notification between the two parties to let them know that a connection has been made. You can look at individuals, and just like we can see the employers here, we can view individual profiles. We can view more about the person who's looking for work. They can share CV about themselves if they choose to. Equally, we've got the facility on here where employers and individuals can choose to keep some of their information private. So you don't always have to advertise your practice or profile on Connect. You can make it visible as and when you have job vacancies that you're recruiting to. I'll stop there for now.
Fantastic, thanks, Rowan. So really quickly, and probably just to kind of launch a poll, do you currently have a vacancy at the moment? And is it a great opportunity to capitalise on the careers event that will be happening next week? So just really simple, yes, no, have you got a vacancy at the moment? Yes, so there's quite a few of you that's got a vacancy. And for those of you that haven't got one at the moment, then maybe this is just something to think about going forward. So in terms of those of you that have got a vacancy, what is it that you're looking to recruit to? Just a really simple word cloud. So what I would do is kind of really encourage you. I think certainly next week at the careers event we will be, because the work with the Department of Work and Pensions, we will be attracting people that potentially have never worked at the NHS before. So those admin reception roles, I think maybe that's something that we can certainly help with next week. Rowan will probably be able to tell you actually the number of people that have already registered with us that are looking for a job. So I know we've already got GPs registered with us. I've literally just come from the Pennine training programme, just been speaking to 40 doctors, and it was something like 80% of them that completed the poll told us that they're looking for a salaried job. So we're pushing that out to the training programmes as well. So now's a really good time, I would say. And in terms of, so thanks very much everybody for that. In terms of kind of the presentation that Rowan's just given to us, what is it that you think, do you need any help with accessing the GM Workforce Connect? Because if you do, we'll reach out to you separately and kind of try and help support you in doing that. Fantastic. Okay, so thanks so much, Rowan. No doubt if you do need help or support, you'll be Rowan or me. Rowan being the technical one. But that's really great. Thanks very much. We hope to see a number of your vacancies appearing with us. Okay, so now really pleased to be inviting Cheryl from NAPC with us today, and Cheryl's got a really interesting presentation to share with us, and hopefully it will kind of be a really great closing to today's session. So over to you, Cheryl.
Hi, thank you. So I'm Cheryl Mackay. I work with the National Association of Primary Care, and I'm part of the care faculty. So I'm going to be talking to you a little bit about the care programme. So the care programme is a programme that NAPC deliver, and we deliver it in partnership with NHS England and Bedford, Luton and Milton Keynes, ICS. And the programme really evolved between that partnership between BLMK and ourselves at NAPC, in that it was a leadership programme that looked at developing leaders across primary care, irrespective of whatever role that you work in. So whilst it started initially with GPNs, first and foremost, we now are delivering this nationally to all the roles that work within primary care. And our programme is probably a little bit different to some of those other leadership programmes that currently exist and that are accessible to people that work across all sectors in health or social care. So I'm just going to slide share a couple of slides to tell you a little bit about the programme. And then I'm going to be taking you through one of our exercises that we do on the care programme, just so you get a feel for what that looks like. Can you all see my slides?
Yep.
Excellent. So care stands for connected, authentic, resilient and empowered. And there are three cornerstones or bedrocks to the care programme. One is about developing everybody's resilience and well-being, and I'll explain a little bit more about how we do that in a minute. The other bit is about developing that leadership system impact. And actually, we believe everybody can be leaders. It doesn't matter whether you're a nurse, any form of clinician, whether you're a practice manager, whether you're a healthcare assistant, whether you're a health and wellbeing coach. We all lead in our own way, and it's about developing that distributed leadership that can have an impact. And there's also something about population health. So they're sort of the three main cornerstones of what we deliver in care. So the programme itself it begins with an engagement event, and we have an engagement event that is taking place next week. So we tell you a little bit more about the programme at that engagement event. For any of you that are coming to that, you'll hear a little bit about what I'm talking to you about today, but you will also hear from a former, if not one, maybe two former alumni of the Carer programme about what it's meant for them, what it's led them into doing, and how it's enabled them. We then have 8 core modules that we teach, and that's focused on population health and resilience and wellbeing. And then we end the programme with a celebration event, and that celebration event normally takes place a month to 8 weeks after the programme finishes. And that programme really is, or that celebration event really is a celebration of some of what people have achieved, the developments people have seen in themselves, but also for some what that's led to, projects that they've delivered. So you'll hear from some of your own cohort in those celebration events. Then we have aftercare. Now, aftercare, we call it continuing care, really, in that we have an aftercare engagement event, and aftercare is very much delivered in partnership with yourselves and your system. And it's looking at it, it may involve support around ongoing resilience and wellbeing. It can also involve support around people's population health initiatives. But through that, dictated by what it is that you need, there may be masterclasses, and they can be in technology, presentation skills, project management skills. The list is endless, to be fair, and that is very much up to what you as a group are wanting at that specific moment in time. And the whole programme, throughout the programme and beyond the programme, we evaluate and analyse the data that's coming out of not just your feedback from the sessions, but also in terms of what it is that people go on to do beyond the programme. And that impact is then fed into the long-term plan, national priorities, workforce, international partnerships and career development. And you know, when we talk about connected, some of our former alumni have gone on to talk at national conferences. Some have won national awards. And they've really found that the programme's given them that platform and that confidence. That's what the resilience and wellbeing session is about, is developing that confidence, you know, that leader that often exists in all of us, but we don't always recognise it. So we have 8 modules. All of the modules are 2 hours long. Accompanying the 8 taught modules is an online workbook, and that will have both some pre-reading, the activities that we cover in the session, and it will also have other resources, whether that be books or online resources that you can access that complement what we're delivering in the programs. Each program is each session is very interactive. So each session, there will be 3 breakout sessions throughout. And what we do is we will teach some theory related to whether it's population health improvement or resilience and wellbeing. But it's very much about giving you the space and the time with your peers to interpret and reflect on some of that information and what that means for you. So all of the blue boxes are our population health improvement sessions. So in our first one, we cover building our understanding in the context in which you work. We look at your role as a distributed leader, and we think about your own ideas for improvement projects and who you may need to help. We also think about in building your project or support team, we talk through a population health improvement approach to workforce redesign, and we talk through some of the Michael West and Lencioni information about the characteristics of great teams, and that helps you reflect on the teams that you sit in, but also about getting the elements right for any project teams. And then we also teach a little bit about influencing leadership and influencing strategy. The green boxes are our resilience and wellbeing sessions. And they are all founded in something called neuro-linguistic programming. So we use a lot of coaching techniques in those sessions, but we really get you to think about you. And some people find that session or those sessions a little bit more uncomfortable. Some people don't like to do that reflection. We tend to do, when we're facilitating those sessions, we tend to have more care facilitators on those sessions, because what we do is when we go into breakouts and we explore some of this as a small group, what we find is the people in those sessions often actually just sharing actually that they're not the only one that has an inner critic that sometimes stops them and gets in the way of them being their best selves or prevents them giving that presentation, and helping them think through together some of those strategies that they can use to manage that. So the NLP sessions and the population health improvement sessions build on each other. So there are interconnections through those sessions. And we also, through the sessions, we do invite some system facilitators from your own system who actually co-facilitate with us around those population health improvement sessions, because they will bring some of the local context into that discussion. So in a sense, we deliver a lot of that in partnership with your system, so there's some localization. So we thought what would be nice is to take you through one of the wellbeing exercises that we do in a session, and we have many, and actually the spiral journal is one of my favorites, and it's one that we do every session. So we start every one of our sessions with the spiral journal. So to take you through this one, I would like to invite each of you here, if you haven't got a piece of paper in front of you, to grab a piece of paper. And then what I would like you to do is fold that piece of paper into 4 and then open that back out. And what you should have in front of you now is a piece of paper that has 4 quadrants. Okay. And now what I would like you to do is draw a continuous spiral as slowly and tightly as possible, starting from the middle of your page outwards, and continue to draw that spiral until I say stop. Okay. Now, I'd like you to write your responses to the following statements. So in the top left corner of your sheet, in that top left quadrant, I want you to write the response to, right now, my body is feeling. Right now, my body is feeling. You might be feeling calm. You might be feeling anxious because you know you've got quite a busy afternoon ahead of you. Right now, my body is feeling. And then in the top right-hand corner, I want you to write the answer to this. The challenges I brought with me into this meeting were. The challenges I brought with me into this meeting were. And they may be work challenges. They may be challenges related to your home life, because we bring all of ourselves to work, and it's sometimes difficult for us to leave some of those challenges at home. And then in that bottom right corner, that bottom right quadrant, I want you to write down your response to something I've been paying close attention to is. Something I've been paying close attention to is. Then lastly, in the bottom left, lately it's been important for me too. Lately it's been important for me too. And that could be get more sleep, prioritize time with your family, could be any of those. And then I'd want you to just have a look at that sheet, have a look at all 4 quadrants, and circle or underline anything that stands out for you in that journal, something that you'd not really been conscious of that's maybe stood out for you. And when we're on the programme, we do use the spiral journal, as I said, every session, but it's a really good activity to do with your teams, whether you're coaching. I know people that use it instead of reacting in the moment when sometimes they get an email or somebody said something, they sometimes do this for a minute because it helps them collect their thoughts, and it helps us sometimes take us to a more positive place. So I'll stop there because I know I've probably overrun a little bit.
Thanks, Cheryl. I actually found the spiral bit quite relaxing.
Mm-hmm. It is. Somebody said to me, why do you do the spiral bit? And I'll often, the reason we use it at the start of a session is we often come into those sessions really, really busy. And it just helps us park some of that, ground us where we are, but also enables us just to calm ourselves. But it's a really great exercise to do with your teams.
No, thank you. So conscious that we might be losing some people as they go on to other meetings at past. We can certainly invite Cheryl back again to do another little bite size if people would find that helpful. In terms of these meetings, recognising some of the things that have been said already, that people, I think it was Hayley that touched upon it before, that people don't have the time to come along to these meetings, and we do seem to have lost quite a lot of people attending these meetings. So it is something that we're looking to address. Please do share the information with your peers if you kind of get to meet at a local level with other workforce leads. We are going to be working more closely with Rose and Anne at GM Excellence to kind of take these meetings forward. So I suppose in terms of what is it that you want to get out of these meetings? So for future meetings, are there any topics that you would like to see that, you know, kind of you haven't seen before? So if there are topics, then please just do pop them on that particular word cloud. And then in terms of you having a voice, and it links into the work that Sati's doing around the non-clinical workforce, kind of getting representation of practice managers on the groups that are happening, which kind of seems to contradict itself, doesn't it? Because we're saying that we're already time management pressed. But is there something that, you know, would you be happy, willing, or able to support some of the programs that are going forward? Anne's got a particular question to ask you, and if you have got another poll, I don't want to close that one down without so I will if oops, where is it? And you just want to give a little bit of background to your digital group?
Yeah, sure. I don't know if people on the call are aware, but there is a digital first academy being developed in Greater Manchester, and there's a digital first group stroke steering group that they're looking for a practice manager with an interest in digital implementation to join the group if possible. There's a meeting taking place on the 17th of May. Unfortunately, I've been trying to get what time it is, but I've not heard back. But the first meeting is the 17th of May. So if anybody's interested in joining that Greater Manchester group, can you could just pop your name in the chat or drop me a line and I'll let you know a little bit more about it. The sorts of things that we'll be looking at are virtual appointments, websites, telephony. So if we've got anybody who's got a real interest around sort of digital, be a really nice opportunity to join a Greater Manchester group. Please let me know. Thank you. Oh, lovely.
Thank you. Update. And the same really for SATI's group. So we have got 12 practice managers that have put their hands up for that non-clinical workforce. But if you feel very passionate about it and you would like to help shape some of those task and finish groups, then again, please get in touch with us and we would welcome you to come along and attend. Fantastic. Thank you so much for coming and spending your lunch with us today. It's been a great meeting and we hope to see you at future meetings. Dates will be following in the next couple of weeks. All right, have a good day, everybody.
Thank you.
Thank you. Bye.
Bye.